Welcome. Have you ever experienced a persistent hoarseness that just won't go away? It might be more than just a cold. Today, we're diving into a common voice disorder, vocal cord nodules and polyps. We'll explore what they are, how they develop, and what you can do about them. Let's get started. So, what causes these vocal cord issues? Vocal cord nodules and polyps are often a result of vocal abuse or misuse. Think of it as overworking your voice. This can include activities like excessive shouting, singing without proper technique, frequent coughing or throat clearing, or even prolonged talking, especially in noisy environments. In some cases, acid reflux or exposure to irritants like cigarette smoke can also contribute to their development. Let's talk about the science behind it. Your vocal cords, also known as vocal folds, are two bands of smooth muscle tissue that vibrate to create sound. When you overuse or misuse your voice, these cords can experience trauma. This repeated trauma can lead to the formation of small, benign growths. Nodules are like calluses, forming on both vocal cords at the point of maximum impact. Polyps, on the other hand, are more like blisters, often appearing on just one vocal cord, and can be larger and more vascular than nodules. How common are vocal cord nodules and polyps? They're quite prevalent, especially among individuals who frequently use their voice professionally. Singers, teachers, public speakers, cheerleaders, and even call center employees are at a higher risk. While they can occur in anyone, certain lifestyle factors and vocally demanding professions significantly increase the likelihood. What are the telltale signs? The most common symptom is a persistent hoarseness. You might notice your voice sounding breathy, raspy, or strained. Other symptoms can include a decreased vocal range, vocal fatigue after prolonged talking, a feeling of something being stuck in your throat, and even pain that radiates from your throat to your ear. The severity of symptoms often depends on the size and location of the nodule or polyp. How are these vocal cord problems diagnosed? Typically, an otolaryngologist or ENT doctor will conduct a thorough examination. This often involves laryngoscopy, where a small camera is used to visualize the vocal cords. There are two main types. Indirect laryngoscopy uses a mirror, while direct laryngoscopy uses a flexible or rigid scope inserted through the nose or mouth. These procedures allow the doctor to assess the size, shape, and location of any abnormalities, as well as observe vocal cord movement during speech. While both nodules and polyps are benign growths on the vocal cords, they are classified differently. Nodules are typically small, symmetrical, and callus-like, occurring on both vocal cords. Polyps are often larger, asymmetrical, and may appear more like a blister or swelling, usually occurring on just one vocal cord. They also differ in their composition, with polyps often containing more blood vessels than nodules. The good news is that treatment is often effective. The first line of defense is usually voice therapy. A speech-language pathologist can teach you proper vocal techniques, strategies to reduce vocal strain, and exercises to strengthen your vocal cords. In some cases, medication, such as proton pump inhibitors for acid reflux, may be prescribed. For larger polyps or nodules that don't respond to conservative treatment, surgery, typically microsurgery, may be recommended to remove the growth. Following surgery, voice therapy is crucial for rehabilitation. Can you prevent vocal cord nodules and polyps? Absolutely. Practicing good vocal hygiene is key. This includes avoiding vocal abuse, staying hydrated, using proper breathing techniques when speaking or singing, avoiding irritants like smoke, and seeking professional voice training if you're a frequent voice user. Taking vocal rest breaks, especially after periods of heavy vocal use, can also make a big difference. What's the outlook? With proper diagnosis and treatment, the prognosis for vocal cord nodules and polyps is generally excellent. Voice therapy and, if necessary, surgery can effectively restore vocal function. Recent research focuses on refining surgical techniques to minimize scarring and improve long-term voice outcomes. Additionally, researchers are exploring new therapies, such as injectable medications, to reduce inflammation and promote healing in the vocal cords. By understanding the causes, symptoms, and treatments, you can take proactive steps to protect your voice and maintain healthy vocal cords.